What would a trip to ASCO in Chicago be without a visit with Dr. Howard Kaufman MD from the Rush University Medical Center? Thanks for putting up with us another year.
You're welcome.
How are things as mayor of Chicago?
Things are going very well. We're very busy here.
Very busy? Good work?
Yeah.
Let's talk about the latest, the PROCLIVITY clinical trial program evaluating treatment of metastatic melanoma patients. What can you tell us about this?
Well, it's really been a banner year for melanoma because we've really had some major advances, particularly in the area of immunotherapy. And so one of the drugs that we've actually had around for a long time is high-dose interleukin-2. And really it's a remarkable drug because we get long-term durable responses in some of our patients. The PROCLIVITY set of studies is to really try to combine IL-2 with some of the other newer agents that are coming on the market, both other non-immunotherapy agents as well as other forms of immunotherapy. And the basis of this is grounded in some very good science in the preclinical setting, suggesting that you can see additive or even synergistic therapeutic effects in animals that are treated with both agents. So one of the studies is actually looking at combining IL-2 with vemurafenib, which is a BRAF inhibitor. And there's a lot of interest in that because vemurafenib has shown an overall survival benefit in melanoma patients last year. And there's some preclinical data to suggest that vemurafenib treatment can lead to an increase in T cells at the tumor site. And so IL-2, which naturally enhances and promotes the proliferation of those T cells, would be a logical partner to put with vemurafenib.
What's been the main driver of this trial coming to fruition?
Well, I think there's a lot of champions in the field that, we certainly want to make advances for our melanoma patients. And I think the progress that's been made on both the understanding the molecularly targeted therapies and their importance in the melanoma pathway, as well as advances in immunotherapy, have led to all these opportunities. And so I think it's really been a true partnership between the academic physicians and scientists who have done some of the preclinical work and our partners in industry, and really working with our patients who have really demanded better treatments.
When are you looking possibly at seeing results?
Well, it's actually turning out now to be harder to do melanoma studies because there are so many options now for patients. So I think it will probably take another year, maybe 2 years to really accrue the patients and then follow them for a long enough period of time. One of the interesting challenges we have in immunotherapy is some of these patients actually will do well for a long period of time. Sometimes they can even have very late responses because of the kinetics of immunotherapy can lead to a delayed emergence of a therapeutic response. So we actually have to follow our patients a little bit longer to make sure that we're not missing a real benefit.
So you've got to make changes on the go then?
Sometimes we have to do that, yes.
Where can people get more information about this?
So these trials are listed at the clinicaltrials.gov website.
Okay. Anything else you want to add, Dr. Kaufman?
No.
Thanks very much.
Thank you.
Nice to see you again, sir.
Yeah, you too.
Dr. Howard Kaufman here in Chicago from the Rush University Medical Center, joining us at ASCO.